Hi, and welcome back to Hill and Ponton's video blog. I'm attorney Allison Reddick, and today we have our returning special guest again, Dr. Al Vanitas. Dr. Vanitas, how are you?
I'm doing fine, thank you. Great to be back as always.
Great. So today we're going to be talking about a very sensitive topic that's close to a lot of our hearts. So please consider this as a trigger warning. We will be discussing suicidal thoughts, suicidal ideation, and suicide as a whole as it pertains to veterans and non-veterans alike, and what type of help is available. So to start, can you give us a quick overview of what is classified as suicidal ideation and suicidal thoughts, and what type of thoughts you should be concerned about?
Yes, they say the path to suicide is thoughts, plan to intent. I've found it really is all about intent. I mean, you could have a good plan about how you might rob a bank, but it doesn't mean you're going to do it. And I think, the ideation comes in, it starts with thoughts about death. Like, what would it be like if I wasn't here? And there is a big difference between what would it be like if I didn't have to deal with this, or fantasizing about a death, versus I actively want to do something about it. And so I would say the plan is where things start to become very real and imminent. Someone who has a very realistic plan and the means to execute the plan, and especially a lethal plan, that's where it starts to become very serious.
So there's a difference of, I wouldn't say it's normal, but I think it is normal to everyone to have days where, things are difficult. There's more difficult days than other, and to have some negative thoughts. And when you have these mental health symptoms where it starts to turn into a plan, that still potentially couldn't be to the point of worry, but it's when you have that plan and you're like, okay, I'm actually going to follow through with this plan. I would say reach out when you start having the thoughts at all, but once you get to that plan, that's when things start to get real, correct?
Yes, and I mean you're right in saying that it is normal to have those thoughts. And I tell folks all the time, some days are just going to be better than others,
Mhm.
and we all go through our minds like where we might entertain all kinds of different thoughts. But it's the matter of putting a plan together with an intent to act on those thoughts.
And I think that is a great point because as we move on in time and move forward, there is less stigma with mental health treatment, but there still is a stigma. And it is important to normalize that everyone has varying thoughts. You have good days, you have bad days, and it's important to accept those thoughts and realize them and seek help when needed. So, specifically for service men and women, I think it's very difficult for them to express those thoughts, especially while you're on active duty service. However, at times things do get out of hand, or they do feel comfortable enough that they can express those thoughts. But what I've been seeing is that there's been this loss in translation when a service member is in active duty and then transitions to civilian life. The medical records, it's hard for them to get their medical records or get them transferred, be able to access them, or even find a private provider versus VA provider. Do you see that as well?
Definitely seeing a lot of that. It is really difficult making the transition from the care in service to outside the service, whether it's at the VA or through a civilian provider. I do see that the folks that keep good medical records, okay, I encourage people to get copies of everything that you can. I mean, even your C&P's exams, you can get copies of those too. There is a lot of red tape that you have to go through to get those records, but anytime you can get records to be able to pass on to the next provider, because you really don't want your next provider starting from scratch with really nothing to go on.
And I mentioned that procedural part of it of access to records because there are plans for VA and the Department of Defense to create like an electronic system, be interoperable, where you can access both of them. There's an article that we can link. However, I don't think that's going to happen anytime soon. So it is very important to try to keep track of your records and get copies whenever. But then going back from that transition of active duty to civilian on a psychological level, there's a huge difference, and that's where a lot of issues come about as well. I mean, when we think of suicidal ideation, we associate it with combat, but even that transition, do you see a lot of difficulty from transitioning from military life to civilian?
100%. And honestly, the transition is where these issues come to light because, I'll tell a lot of veterans that if you were around other veterans the whole time, you might not have ever even noticed this stuff. It's when you're around the civilian people, it's them, it's they who notice the behaviors. It pops up on their radar. So that's where the transition becomes difficult, is when you're surrounded by family members and friends that are really very acutely noticing, like, why do you have to look to see what's going on, or what do you think's going to happen in this place, or why are you being paranoid, why are you waking up in the middle of the night and walking around the house 3 times? These are the things that pop up on their radar as a flag that there's something going on here. Now, as providers, realistically, when any provider in mental health is finished working with a patient, a client, for whatever reason, I mean, there is an oath of doing no harm. I mean, in the field, that's basically called abandonment. When, you say to them, well, this is our last session, good luck out there. That it should never really come to that. There should be a smooth transition. Now, certainly in the military, they're working with different types of guidelines, but that's where the individual can get those copies of the records to help make that transition a little smoother.
I feel like, though, that isn't happening at all, because I will read records where someone is struggling mentally, and the doctor will note, I recommend that you seek help when you get out of service, but there really is a disconnect.
Yeah.
And so you kind of have to be an advocate for your own care, and that's very difficult to do with such a sensitive subject.
That's exactly true. You do have to be an advocate for your own care, which does make it difficult, especially if you're not really sure it's happening at that time. Like I say, some of this stuff tends to get worse with the transition. There should be something set up to make that process smoother. But at this point, communicating with other veterans, getting in touch with a veteran service officer or somebody who has experience dealing with the transitions can make it a little easier.
Because I think even that loss of structure, because in the military, it's very structured. Everyone follows a certain set of rules. You get up at a certain time, you have certain duties that you're supposed to follow. And then when you come back to the civilian world, it's chaos. And that can have a significant impact on your mental health as well.
Absolutely. The military does a very good job at focusing on the details of things. And there's good reason behind that. A lot of times people will question, like, well, why do I have to make my bed the same way this guy does? Or what does it matter if my belt buckle is in the same place as his? But these are all small microcosms of this bigger picture in the service, that if we can't count on you to dot the I's and cross the T's on this little stuff, what are you going to do downrange where we really do need you to hold yourself accountable? Now, you're exactly right. When you come back here into the civilian bubble, I like to call it the civilian bubble, people here are going through the motions. It's really no big deal. Everything just kind of boils down to time and money. Like, okay, well, they'll hit me with a late fee. Or so it's real no imminent threat in a world where all that really matters is time and money. That is a very difficult thing for veterans in that transition, because now the little things start to become a big deal.
Absolutely. And I just, really focus and point that out because I know there are people out there where they are struggling with these issues. And I want to normalize it to show that you're not the only one struggling with these issues. This is something that's very common, and it's common to seek help for it, and it's okay to seek help for it. Specifically for deployment, I know that's where a lot of the PTSD and mental health issues stem from. We've heard that veterans are supposed to be screened for PTSD when they return home from deployment by doing an interview with a mental health professional before discharge. How accurate is that? Do you know?
I would say that can be about 50-50. It really does depend on who you're talking to, the generation of I mean, if you're talking about the Vietnam guys, most
True.
of them were not screened at
Hmm.
all.
Well, because they
And
probably didn't even know what PTSD was
well,
back
that's
then.
true too. It- But then it also becomes at how thorough of an evaluation is this? A lot of times I get the old, do you want to hurt yourself or anybody else? Thank goodness. Okay, you're good to go.
Mhm.
And I mean, don't get me wrong. I mean, that's you get information from that, but I don't believe the type of screening that was intended for this and folks coming back from deployment.
Well, and it seems that this is something that would need to be discussed over a longer period of time, at least an hour, to tease out those questions. I mean, these are very sensitive subjects that if you just ask, are you going to harm anyone? No. Okay, check. Next. Just because you're asking this question in a specific way doesn't mean that there's underlying issues that could cause them to want to harm themselves or someone else.
So that brings up a good point too, and it is about rapport, okay? Because the veteran a lot of times doesn't want to be there. They don't want to do this, and the provider senses that it builds like a fear. So both parties are now just trying to get through this,
Mhm.
okay? Instead of focusing on building that rapport. I mean, when you're talking about self harm to a combat veteran, on the other side, they're seeing that as who are you to even ask me that? You don't even know me, you know? And
Mhm.
so to get to that point, it is very similar to any kind of relationship. If you go on a date, the first question is not going to be, so ready to go home? It's like, well, wait a minute. I mean, you gotta kind of move this along a little bit to get to that point to even go down the road of talking about those issues, because the trepidation the veteran feels is like, well, how can I even trust you to even tell you this, that you're not going to use it against me? And sometimes I do feel like these screenings are an abbreviated version because of, like I was saying, folks on both ends of it just feeling the angst and the negative energy in the room to the point where they just both want to end it as soon as possible.
Yeah, I talk to veterans every day and I say, well, you were having these thoughts or you had these pains in service for, physical things. And why didn't you say anything in your exit exam? And they're like, well, I just wanted to get out of there because if I say something, then it's going to delay me being able to discharge. Same thing with these PTSD screenings. One, not only is it going to delay it, but two, at that time, in that moment, you may not feel anything. Whereas a week later, 2 weeks later, month later, year later, something could trigger you, and then all of those symptoms come kind of crashing down.
To be honest, the best way to do it would be to wait a period after the veteran
Mm.
has separated. If you talk to most combat veterans a month or two after they've been home, okay, give it 90 days and ask that person, how are you sleeping? How are the relationships with your family? Are you getting mad at anybody? Are they noticing you getting real explosive? How are you in crowds? How are you at Disney World? If you're starting to see like that, none of that is going very well, we can start to go down this path of post traumatic stress.
And I think that's such an important point that if, yes, they are doing these screenings for PTSD, but they're still, it's right after. Maybe they should be doing these screenings 3 months later to see how being back in the civilian world, even though they've discharged, how that's affecting them. I think that would definitely reduce veteran suicide and increase access to care. But it's kind of like once you're discharged, okay, you're kind of on your own and got to advocate for yourself.
It's like this washing of hands, like,
Mhm.
okay, we're done, and even just being third party, I feel it. I feel what they feel. So, and there's too many folks that have mentioned that for it not to be a thing.
Absolutely. How often are you seeing vets with suicidal tendencies?
I would say in the neighborhood of maybe 20%, one out of every five. Thoughts, I'd say, would be, yeah, one of every five that would admit that they're having a thought. Some of them will say once in a while, some will say not in a long time, some will say every day. Think about it, every day.
Mhm.
But then we go into why they wouldn't, or the things that they would do when the thoughts start to take them down that road. And many people, the barriers or why they would not do it are usually family members, especially younger children and things like that. Religion is another big reason why people wouldn't. Christianity and suicide do not mix very well. Other than that, Those are the two, man. And I've had some folks even say they've been close with animals that wouldn't have want to abandon their pet, which is anything that could be used is a good thing. But those tend to be the reasons why people don't go down the road of actually doing it.
But even if you have those protective factors, that still doesn't take away from the fact that you're having these thoughts. I mean, I still think that they're indicative of you're struggling internally with something. And even though you're not going to follow through, it's not active, these still would be considered passive suicidal ideations, correct?
Yes. The less people in the person's life, the more serious I feel the threat. If there's someone in the home, a daughter or a spouse, it feels a little better that the other person is also in part of it, as opposed to some folks that are just with nobody, on their own. And when you're in your own head like that for that much time, you can get to pretty dark places.
Would you say that suicidal ideation is at a higher percentage in veteran populations than the general population?
I would say yes.
Just because of the experience that they have and their lifestyle?
All of it, being around death, seeing others doing it, or learning that others are doing it. I mean, so suicide is an escape. It's the last route of, this is so bad, I need to get out of this place. So that's the ultimate abort button, and so for things to be that bad, it's every area. It's motivations, zest for life, interpersonal relationships, friendships, work, even intimacy, personal space, don't touch me. It just gets to be to a point where lifestyle quality is so low that the only option is out. And so that's why I tend to see that more with veterans than the general population. Of course, most of our work is with veterans. It does seem like, as a whole, I mean, certain situations in the service can be very depressing, even for the most upbeat people.
I know in the past we've discussed the diathesis stress model. Could you give an overview of what that is and how it pertains?
Yes, certainly. We all come in the world hardwired with our genetics we are who we came from. That's what I tell people is, if you're having thoughts of suicide, chances are somebody in your family did. If you're having depression, somebody in the family. If you have gout or, allergy, somebody in your family has that. It just didn't come out of space. So a lot of folks do have a predisposition for mental health, whether it's depression or anxiety. They're more likely to experience the symptoms. And so the stress of the service or an intense environment, circumstances, stressful situations, let's say you just had one toe of genetics in the depression pool, the situations or things you encounter in the service could push you all the way in. Mm-hmm. So it's like we have this genetic piece of it, and now it was something in the environment that unlocked it or manifested it in a much stronger way.
So if you have a family history of some type of mental health, whether it be depression or anxiety, bipolar, anything, this model is stating that you more likely be predisposed to have a more significant effect in stressful situations.
Yes. Somebody who's genetically predisposition, their predisposition has an element of this a piece of mental health, whatever it might be, an extremely stressful situation could exacerbate or move the symptoms along. Then it becomes a question of, if that individual was not in those circumstances, would the depression or the anxiety even come to fruition? Maybe not.
So let's say in a perfect world, the military is doing entrance examinations and they see that you have a family history of mental health issues, but you specifically don't, but your family does. But they see that as a potential of, okay, if we were to deploy you, you may more likely suffer negatively from this deployment. That potentially could reduce the amount of people that are affected so severely. But regardless of if you have this predisposition or not, experiencing these significant triggers can affect anyone.
That's true.
Interesting. So, okay, we're not in a perfect world and this isn't happening. And there are plenty of people in the military who have family history of mental health issues. Let's say you're going to be deployed. Is there any way to prepare yourself to cope with potential experiences or trauma that you could be exposed to?
It does seem that youth is more likely to be traumatized. What they call the reminiscence bump between the teens and 20s. This is when everything's new. You know,
Mhm.
driving is new, dating is new, alcohol's new. Not until you're getting, later years, all that stuff becomes old hat. But when it's new to you, these experiences are extremely impressionable. And so I do believe that's one piece of it. A lot of times when I talk to people who went in the military, I don't believe that they knew what they were really getting into. Their perception of what war was going to be was nothing like what it was.
Mhm.
And in preparing somebody for what they might have to do over there, it is interesting because, my dad served at the Naval Academy and, he would talk about these videos, these horrific videos of like things that would happen in the villages that were taken over. And it is really horrific stuff that they would make them watch to prepare them.
Mhm.
And I told him, I was like, those videos in itself are traumatizing. And he's like, it's true because I think about the videos all the time. And so it really is about what your experiences are. The truth of the matter is, the more detached you are, the less you're apt to be traumatized. So if you're the kind of guy or kind of person that gets into the service and you want to make friends and get to know everybody, I'm not going to say it can't be like that, but you might be disappointed. I mean, you really need to go into the situation thinking the person to the left of me or right of me might not even be here in 30 minutes for whatever reason. I might even have to be out there picking that person's body parts up. And that's real. I mean, that is real. And a lot of people do not understand, like, this is war. This isn't a job. This isn't a relationship that went awry. I mean, this is survival. This is guard this on a minute by minute basis for who knows how long and go. There's no sleep. There's no 5 o'clock margarita time. It is constant survival. And when you take somebody from this civilian Disney world of a country we live in, where you can go to Walmart and get 15 flavors of Gatorade 24 hours a day, and put them in that kind of environment, and then expect them to come back here and get a job and, oh yeah, just have some kids, take the kids to school, to Disney World. It's just very unrealistic. It is extremely unrealistic to think that that is going to be a smooth transition.
I think it's also extremely unrealistic to prepare anyone. It's against human nature to not have any empathy or care for anyone because I think there are plenty of 18, 19-year-old men or women that go into the service thinking, this is my focus, I'm here to serve. But then they do develop relationships with their unit. And regardless, you're going to have an emotional reaction if that person is gone. And going back to you saying that it's very impressionable on young people, Vietnam, you're deploying 18, 19, 20-year olds men.
A lot of these
Um,
guys were from small towns. I mean,
exactly.
it was like, 40 people in their high school. I mean, and now you're in a situation where stuff blowing up. I mean, that stuff forever changes the way you navigate through the world. You'll never just turn your back and trust the environment after you've seen it in action like that.
Mhm.
Yeah, I do feel like that is a big piece of it, but also what makes it difficult in the transition is there's different rules. I mean, here in this US of A, they are expected to commune and gather with other people in groups. And that is just not what survival looks like. Survival is we gather the essentials we need to survive: food, water, shelter. We establish a perimeter and we keep every other human being at bay. That's what survival looks like. But here, oh, well, that's antisocial. Why won't you come talk to us? What, you don't like me? And it's like, it has nothing to do with you. It's the global you. It's all of you. But to walking through that in a civilian, a person who has never really been in those kind of situations, it's going to be very difficult for them to understand the veteran now who has seen those things. because more likely than not, your combat veteran was your average person. This was your prom king or queen. You know, they were in all kinds of clubs in high school. They excelled in all kinds of different sports. They were leaders, very outgoing. Now, all of a sudden, can't stand in line in Publix with 3 people behind me. Something happened. Those transitions, yeah, very extremely difficult.
So with these difficult transition comes these negative thoughts and feelings, and there's a lot of self-medication, whether it be alcohol abuse, opioids, meth, and other things like that. Why do you think that's happening there? Is it a trying to numb or get rid of those feelings or thought, or is it a replacement for treatment? What do you think?
So alcohol is the one I tend to notice the most. And the truth of the matter is alcohol works. After enough alcohol, the veteran does not care what the people are doing across the street. And after enough alcohol, you will get to sleep. Even if you don't want to sleep, the vigilance, the hypervigilance goes down. The anxiety goes down. You even get a little more social. You know, you might even crack a joke if you've had a couple beers. Where it gets into trouble is where there's too much, it starts to bleed into anger, outbursts, punching holes in the wall, missing work, you know, driving drunk, getting DUIs. But on the front end of it, it absolutely does what the person suffering from PTSD is looking for, which is I want my vigilance and anxiety low because I am tired. It gets exhausting scanning the environment for threats and rehearsing scenarios about what I'm going to do if X, Y, and Z happens. After enough of this, you stop caring about it. So I do believe that in itself is extremely reinforcing and gets people on that train, which then can lead to other things. A lot of the folks I see now, they do not like taking pills. Most veterans do not like to take the pills. The side effects can be brutal. A lot of them even affect the mechanics of sex, which, you know, giving a depressed male medication, it just sounds wrong right from the jump. You know, a lot of people are going the route of medical marijuana. That seems to have the absolute least side effects. The only negative thing I've heard from that is I don't like the way it makes me feel. I like being a little more upbeat. Other than that, every once in a while, the hard stuff, the opioids. Most of the veterans that I know addicted to opioids or had an opioid addiction were prescribed those medications for pain. And they suffered some serious injury. They got on the medications, and then those medications took them down a whole nother rabbit hole outside of the stuff from the post-traumatic stress, which I do find is a problem when we get too focused on substance abuse and not focused on what's really driving the train. Like, why did that person go down the road of needing that to cope? I do find a lot of folks going that route. I would say alcohol is the most used, but alcohol is also the worst one for suicide too, because you start to, one, get the courage. You know, most people are scared to do something like that, but after enough drinks, you start to really feel like you can conquer the world or do whatever you were afraid to do. But then the other piece is you start to stop thinking about the consequences. You know, it's like, what does it even matter? It starts to become very narrowed, myopic type of thinking when you're going down that road. I mean, and I do feel like alcohol is probably, even though, like I say, it helps on the front end, it's one of the worst things for when you're by yourself, you know, and you're really down and sitting there with a glass of bourbon and a revolver. That is never a good scenario.
I think it was interesting that you pointed out that a lot of providers hone in on that alcohol abuse. I mean, I see that in C&P exams all the time where the examiner will say, oh, well, they're having these depressive symptoms because of alcohol abuse, but they're not looking at the bigger picture to see what's causing that alcohol abuse. And that goes hand in hand with major depressive disorder or even PTSD. They're utilizing that alcohol to cope with the symptoms that they're suffering from. But as you mentioned, alcohol, and I'm sure the other substances as well, this self-medication, it helps, but overall it more hurts because then you're more inclined to attempt, not just have those thoughts. You may feel good for an hour, but then alcohol is a depressant, and the way it affects your body, and then those negative thoughts, and you get the courage to actually attempt.
Yeah.
So I would not encourage anyone to depend on any substance unless it's regulated by your doctor. But in the real world, that's how majority of veterans are coping. I mean, I have veterans say every day, yeah, I have a couple of drinks because it reduces my vigilance, and I feel a little more comfortable. But then there's that negative side of it. So what is your recommendation for coping with these thoughts, and what to do if you feel like it's getting to that point where it should be seriously factored in and get help?
The bottom line with alcohol and drugs is that you cannot drink, drug, or medicate away experiences. Once you've actually been there and seen it for yourself, these are just Band-Aids. I mean, they might help take the edge off of things here and there. They might help you to be what I like to call tolerant of people, but it is not going anywhere near what is driving the train of all this. Okay. And so the best recommendation I have, if you are out there and even think that these thoughts could even go down that road, or maybe are afraid that I don't want to become like one of those people, it's important to get on it early. Do not wait until the 11th hour where you're reacting to things. Stay way ahead of it. In doing that, I do encourage folks to find somebody, whether it's in the VA or using the Veterans Choice, going outside the VA, or taking service-connected benefits and putting them towards insurances. Like I recommend Cigna, TRICARE, Aetna, those are all good ones. To search providers within a 15-mile radius of where you live. You don't want to be traveling all over your state to get to these appointments, or find somebody who you can do it even virtual with. To establish a rapport and know that this person's going to be there when I get into these dark places. I have someone I can contact or set appointments with, because when it gets to the point where it's crisis, the only thing left at that point is Baker Acts and hospitalizations. And what I tell folks with PTSD veterans is that's where you're going to see the real mental health. Okay. And folks that have been in there know what I'm talking about. In a crisis unit, you're going to see people where the mental health is on the inside, where they're affected by neurochemicals, real schizophrenia and bipolar. Folks with PTSD, it's because the environment did something they witnessed, something they experienced, something they endured. They're not psychotic. Even the ones that are seeing things and hearing things that aren't there, a lot of times that's just the hypervigilance as a dress rehearsal of what you would do if those things were there. But the crisis unit and those inpatient places are places we want to avoid if we can. If it gets to that point, and I always say if it's an emergency, that is the route to take. But more likely than not, you're going to be given a lot of drugs and come out of there with the same problems that we had when we went in with, because we never really, again, we just Band-Aided it up, patched you up, and good luck out there. That's really not going at what is driving this train. So I do feel like it's important to get these things set up. And I do encourage folks to start at the VA, but each VA is different. And if you're not feeling like you're getting good service, it is about being proactive to go outside the VA, or have, family members, even a close friend or a neighbor that is going to consistently follow up with you or check in, or vice versa, you checking in with them, or letting them know not in a great place today, those kinds of things.
I think that is excellent information, and there's a few points that I really wanted to harp on. Early on, you said get help early on, and I think examples of when it wasn't possible are Vietnam veterans. One, they didn't know why they were having these issues, so they didn't know they should have gotten help. And a lot of them didn't get help for 30 years. And like you said, experiences, you can't get rid of those. So that those untreated mental health symptoms just got worse and worse, to the point where they could become psychotic symptoms. So I think it's just extremely important to learn from that situation where they didn't even know that even if you're having mild symptoms today, that doesn't mean you're going to be having mild symptoms a month from now or a year from now. And it's important to go in and just start with with something and with someone. And it may not be the first provider you see. It may take, seeing a couple different people, and that's okay. Don't stick with the first person, because it has to be someone you're comfortable with, and can build a relationship with.
Mental health, it's kind of like, dating in a way. I mean, it really does have to be a connection with somebody you trust, and I tell folks this all the time. When you think about who you go to get your car service, you got a guy. If you're going to get your hair done, you have a stylist that you go, this person, you've been dealing with them for years. Okay. And that's just that stuff. Okay. That's just hair and my getting my oil changed. I mean, we're talking about some really personal stuff here. And it can't be first session every time where it's like, oh, I had Dr. Jones, he's great. And you walk in and it's like, oh, he's gone. We got Susie now. And you got to start from scratch. And it's like, and of course, they don't pass on the notes. So it's like, so what brings you in today? And then that stuff becomes extremely more damaging than helpful. But just because that's not a good experience, that doesn't mean that they're all going to be like that. I mean, there are a lot of folks doing a lot of good work with veterans, but, again, only the negative stuff really gets publicity. But I do feel like it is extremely important to get on this stuff early. I mean, I don't want to be a Debbie Downer here, but don't assume it's going to get better. Don't assume like, it'll probably just work itself out. That is a bad way to go. Here are the barriers of why people don't get help. One, I saw a lot of other people over there, a lot worse shape than me. I figured they needed it more than I did. Okay, that's one major barrier. Two, I just thought this stuff would I didn't think it was that big of a deal. I mean, I just figured, it might last for a couple of years, but here we are now, 2 decades later, and this stuff is still here. And then finally, 3 is, well, we just don't talk about that. We're Marines, or, we don't entertain our feelings. You push through and stop being a baby about it. Okay, so those are the barriers that keep people from seeking the treatments. And I tell folks, this is like going to the bathroom. We could sit here all day and play that we are tough and not going to acknowledge the fact we have to go to the bathroom. But believe me, it's going to come out somewhere. Whether you're in your sleep, this is going to come out in your life somewhere, regardless of what you try to do to fight it. So I would embrace it. Go at it. Do not wait for it to come to you.
And that treatment early on, even if you aren't having significant symptoms, can prevent those symptoms from getting more severe, as well as it's evidence if you do have a benefits case. I mean, at the end of the day, if this is something that you experienced in service that caused this condition, you can get benefits for it. And having that treatment is extremely important to show that, 1, you have a diagnosis, 2, you're getting treatment, and 3, proving that it is connected to service, and to evaluate your level of disability due to that mental health condition. I mean, passive suicidal ideation, if you're experiencing that, that's a 70% rating. I mean, if you're experiencing these thoughts where you don't want to get through the day and it's negatively affecting you, that's going to have a severe effect on your ability to contribute and be a part of the world. So don't be afraid to speak to professionals, because no one needs to know about it. Who's going to know that you saw them? I mean, there are protections for your health where no one can know about it. So go see providers and be honest in what symptoms you're experiencing. And it may take time to find the right provider for you, but in the long run, it's going to help your mental health. It's going to help your physical health, and it can help your benefits case if you have benefits case. We'll also be sharing suicide prevention resources below the video description and in the comments. But Dr. Vanitas, do you have any additional resources or words of encouragement for veterans in need?
Well, I just want to say that it's important to find providers that are local to you, whether that means like Google searching them, and read through their profiles to see if it's going to be a good fit. There are many different approaches to mental health. Many veterans I've talked to have a very bad experience and don't go back, to the point where they almost want to strangle the provider. If you could believe that it could be that bad between the therapeutic alliance, but it does happen. And so just because there is a bad experience, I mean, it's different strokes for different folks with this. And what works for some people is going to be the antichrist to somebody else. So it is important to find a provider that you do have a connection and a vibe with, and to get on these issues before they become issues. And, listen to the people around you. If they are giving you feedback, even though it might not be what you want to hear. I mean, nobody wants to hear like, well, you're not the same guy anymore. Nobody wants to hear that stuff. But the fact is, if they're seeing it like that, it is worth taking a look into that.
Absolutely. Well, thank you so much for discussing with us. Thank you, watchers, for getting through this with us. And I hope this wasn't triggering in any way. If it was, please use the resources below and know that this was an open conversation about a tough topic that is way more common than the public lets on. If you like this video, please subscribe so you don't miss our next one. And leads us to Dr. Vanitas. How can veterans find you to get help from you?
Please look for us on the internet at Von Care. That's VON Care. And also, I'm also doing podcasts at Doc V for Vets. You can Google search Doc V for Vets or Von Care, and both should pop up. But other than that, thanks for having me again. Always a pleasure to do these. I do feel like we can reach out to a lot of folks this way, so it's a great thing, and I thank you for having me be a part of it.
Absolutely. Until next time, everyone, have a good day.